Happy evening, a very good evening. Welcome to this session, which is your one day after your INICET exam. So, in our today's session, we are going to see that what lessons INICET has taught us and what can we learn for the upcoming NEET PG exam, your FMG exam, whatever exam you are targeting at. Right? So, before I proceed with the session, a quick note about the audio visual. Thank you, Flawless. It's me for that note. Thank you so much, everyone. So we had our INICET exam, the first of its kind exam yesterday, and we are having mixed response from the students. Some students are saying it was awesome. Some students feel that it was difficult. It happens with every exam. So we will see a quick overview for how it was. So this would be important for the students who are appearing for upcoming exams. Also for the students who are in their undergrad days to understand how the pattern of the PG entrance exams is changing. Okay. And before I proceed with the session, I want to, convey my heartfelt thanks to each one of you for this lovely messages that I have been receiving after the exams, that how the sessions that we had on cheat codes, mnemonics, radiology helped you in sailing through the yesterday's exam. And I assure you that even in the upcoming NEET PG exam, I will strive my best to help you sail through that as well. So worry not. Even if your exam was not very good, you have more exams coming up. And as you can see that from the very few topics that we have discussed, there were quite a few questions. So that says that, rather than running behind too many topics, new topics, it is the best thing to do is to focus on the must-know topics. Only when you have mastered those topics, then it makes sense to go ahead with the other topics. So thank you to each one of you who's been following my sessions on Unacademy, on my YouTube channel, on Unacademy YouTube channel. It's great connecting with you all and to see how much you are loving the sessions. So first of all, congratulations to those who have fared well in the yesterday's exam. We are waiting to interview you after the results. For those who feel that they could not give their best shot, worry not. Keep your calm because there is always a next time. So in next 2 months or so, you have NEET PG, right? So worry not because there's always a next time. So at the same time, this does not mean that you just sit back, you have a laid back attitude and every time we keep saying there's a next time. So please don't do that because there is also a concept of it's too late. So don't say there is still time or maybe next time every time, because there is also the concept of it's too late. Okay, so the point is, if you have not fared well, make your NEET PG as the final target. Like it would be an all or none phenomenon for you for the upcoming NEET PG exam. Consider it like to be the last exam for PG entrance that you would be having, and you won't be able to enter PG after that. Only if you have that attitude, then you will give in more than 100% for your preparation. All right. Now, how was the difficulty level of the exam? So this, whatever I'm telling you is based on the reviews that I have got from quite a few number of students. So as personally, if you ask me as well, I found the paper was not difficult at all. Okay, it was not difficult for sure because all the questions were on the frequently asked topics, the frequently repeated topics. There was no topic which was like out of the box and unknown topic. So I would say it was not difficult. But at the same time, when we say that the paper was not difficult, that means your cutoff marks will rise for sure. So the paper was, we can say, moderate, not very easy, not difficult. It was a moderate pattern. Considering that we had JIPMER, NIMHANS, PGI, AIMS, everything clubbed into one. So the pattern, that we were expecting, the level of questions, it was really not that difficult. Okay, so it is like Khoda Pahad Nikla Chua. I felt absolutely like that after seeing the yesterday's questions. The pattern, as we all know, was the single best response type. There were no PGI type questions where you had multiple options correct. But in the single best response type, there were questions, your MCQs, the SBA type answers. You had match the following. You had multiple options correct. So these are the questions that actually, added to the confusion, and these are the questions that were time consuming. Right? Since we did not know the pattern, we did not practice many of these questions. So I hope all of you learn from these that only mastering theory is, does not give you a good rank. You really need to develop speed as well in your exam, because many students found that the paper was a bit lengthy, especially because of your multiple options correct, like you had ABC correct, BD correct, AD correct. So such questions tend to take more time. So please, for your upcoming exams, focus on the MCQs. Okay, focus on the MCQs. Image-based questions, yes, they formed a good number of questions in the exam yesterday, but the bad thing was that the images were very, very small. That is what we got to know. The images were so small that the students had to actually go towards the screen and see what the image is showing. So those who had a good near vision, it was good for them. For others, they had to really strain to see ki kya tha. There was one question which I got to know did not have image at all. The image was not loaded at all. That was a question on your Corynebacterium diphtheria staining, the sequence. But the image was not there. Plus there was another question which was on pilocarpine, percentage पूछा था, उसमें दो options same थे और percent mention ही नहीं किया था. So for these two questions which absolutely make no sense, I would really suggest that all of you should write down a mail to the AIMS people and request them to reconsider these questions, because ethically, it's a fair thing that all of you should get marks for these two questions, the bonus marks for these two questions. Each one of you deserve that. Okay, so please do that. Do your bit to get those 2 marks, and surely those would be considered. It happens in every exam, 1-2 mistakes are there. Now the images which were there, if you see, this was the image which was asked in the exam, and when we Google this image of Ascaris, exactly same image that is what we found. So the images were also not taken from some reference book, like we feel yeah, Harrison se image aayega, Robin se aayega, idhar se aayega. The images were just Googled. Seems like the paper was set in a much hurry. Too many institutes led to some confusion, it seems, in setting the paper. The images were from Google itself. If you see this image, like you got this image yesterday and the question was identify. Now what we do up till now, we practiced parasitology eggs. Each one of us had mastered that. But now the examiners were smart and they said इस बार egg नहीं पूछते हैं, हम पूरा worm पूछते हैं कि कौन सा है बताओ. And you had options Ascaris, Ankylostoma, Enterobius, those options. Now, in such questions, as I always say, please use some cheat codes. You have to attempt maximum. And you can see that it is a rounded end. So the answer is roundworm, that is Ascaris. Okay? Many of you marked hookworm as well. Hookworm, hook के जैसे होगा. ये आपका जो roundworm है वो rounded होगा. You will see the rounded end. So the terms itself many times help you to solve the questions, right? When you look back, you come out of the exam hall, you realize that you made quite a few silly mistakes, okay? And this was the image, your Zika virus, right? Many of you have confusion, Zika virus tha, ki rubella tha, ki CMV tha. Just because many of us could see that there is microcephaly which was mentioned in the image, right? There was microcephaly mentioned, जो बहुत छोटा सा mention था. If you strained your eyes, you could see that. The answer was Zika virus. This again is your image from Google. वहाँ से उठा के डाल दिया. ठीक है? So that was the question. You had Hofbauer cells in the placenta and you had microcephaly. Those were the clues for your Zika virus. So this was the image. Again, if you Google out, you'll get the same image which was asked. Peripheral blood smear may identify the cells, which is eosinophil, neutrophil. So what we can see is your basics are a must know. Please do not jump to very hi-fi topics without clearing your basic concepts. Now, identifying a neutrophil, a lymphocyte, a monocyte is something which is expected from all of us once we graduate, right? So if you see, the questions were of the pattern which each one of us should know, okay, once we clear our MBBS. Now, questions we already said. If you see, there were quite a few questions which we had discussed in our sessions. For those who are Unacademy subscribers, had an extra edge, we have discussed quite a few. This was the topic we had discussed on YouTube session. So the take home point is, when you think that it's a YouTube session or a free class on Unacademy, does not mean that, it is not worth it. Many questions have appeared from the free special classes and YouTube sessions. Like we had discussed, all the braces, the splints in orthopedics, we had a YouTube session, right? So there was a question on Milwaukee brace, identify the brace, okay? So for your NEET PG exam, make sure that you do not miss on any session. Now, just a quick review of the questions that we had discussed this in our sessions. So gene mutation, आपका एक JAK mutation पे question था. It's a quick review for your exam. If we have FMG candidates also here, you know that polycythemia vera has a JAK mutation. There was a question on mantle cell lymphoma. What was the question on mantle cell lymphoma? We had discussed this again, cyclin D1, right? It is cyclin D1 positive. Orthopedic braces, हमने already देखा, Milwaukee brace. All this we have discussed. High anion gap metabolic acidosis. So you had an image which many students found was very difficult. जो आपका एक image होता है, metabolic acidosis, respiratory acidosis. If you think very logically, it was a very easy image. It was a very easy image. If I have to tell you about that image in short, basically if these are your four quadrants, this is pH and this was bicarbonate on the y-axis. We know that whenever there is acidosis, the pH decreases. So that means these quadrants will tell you about acidosis. These quadrants will tell you about acidosis. Here you have bicarbonate decrease, here you have bicarbonate increase. So we have had sessions on acid-base disorders where we discussed the mnemonic ROME, right? ROME में metabolic is equal. यानी metabolic में if pH decreases, bicarbonate also decreases, your PCO2 also decreases. So this component which you see, जो bicarbonate भी कम हो रहा है, pH भी कम हो रहा है, this will become your metabolic acidosis. So the diagram which comes here, this will be metabolic acidosis. This you can see respiratory में opposite होता है, pH कम है, bicarbonate बढ़ेगा, ठीक है? तो उसमें when you see the bicarbonate is increasing, so this is your respiratory acidosis. This is your respiratory acidosis. Here your pH is increasing, bicarbonate is less. Can you tell me what quadrant does this indicate? Is it respiratory alkalosis, metabolic alkalosis? What do you think this quadrant? Let us label it C and let us label this D. What does quadrant C and quadrant D indicate? Now you can think very logically. Here you have pH which is more and you have bicarbonate which is less. So what will be this? This quadrant indicates, yes? Absolutely, this is they are going opposite. pH is increasing, bicarbonate is decreasing, pH increasing. So this is alkalosis. This is opposite. So this becomes your respiratory alkalosis because they are going opposite. What do you see here? The pH is increasing. ये आपका x-axis है. तो pH बढ़ा हुआ है. Bicarbonate भी बढ़ा हुआ है, right? The bicarbonate. So they are in the same direction. Metabolic equal, same direction. So this is your metabolic alkalosis. This is your metabolic alkalosis. So what do you see? This is your respiratory acidosis alkalosis. This is your metabolic acidosis alkalosis. So if you see, the image is very easy. बस आपके ये चार quadrant है. ये है आपके metabolic वाले. ये लाइन और ये वाली लाइन है आपकी रेस्पिरेटरी वाली. इफ दिस इज द पीएच कम हुआ तो ये आपका एसिडोसिस है और ये वाला साइड आपका Alkalos is it, right? So do not get scared. The take home point is do not get scared by looking at such, scary diagrams which try to scare you. If you maintain your calm, I always say you will be able to solve the questions. Okay, it's very, very easy. Next question, we had chest CT with dilated bronchi, right? There was a CT image of bronchiectasis, which we have again discussed. You have cramp track sign, signet ring sign. The history is very classical. When you have a 45-year-old male with purulent cough, you have a CT image. We know HRCT is the best investigation. That is your bronchiectasis. Q SOFA score for the students who have attended the class in Unacademy. Remember Q SOFA score, the parameters are same to what trauma score in Q SOFA score? So this session is both your academic revision, also a quick revision, because you do get questions from AIMS in your NEET PG as well. Okay, so we'll see some questions quickly and then we'll jump to the lessons learned. Okay, so there are lessons learned that we will be seeing. Absolutely right, guys. So it is your RTS, the revised trauma score. हमने देखा था कि दोनों के components same हैं. Mnemonic क्या देखा था? Cheat code to remember your components of RTS, the revised trauma score. The RTS, the mnemonic itself helps you to remember respiratory rate, trauma. Trauma में it is your Glasgow Coma scale that we use, and S is for systolic BP. S is for systolic BP, not diastolic BP. So we had discussed that your Q SOFA score and RTS, they have the same components. So this is what the question was. What is not included in Q SOFA score? Respiratory rate. GCS के बदले में दिया था mental status. You had blood pressure and you had heart rate. So heart rate is not included, right? We have discussed all the trauma scores. Please watch that session. Very, very important. You do get a question on that in every exam, okay? IV cannula, right? There was a question on 20 gauge pink color IV cannula. We have seen the mnemonic for that as well. Remember that plant wala story? प्लांट है, फ्लावर है, फिर आपका स्काई है, सन है, अल्ट्रावायलेट रेज है. So we have seen that this you had a green tree and you have a pink flower, right? The pink flower, that is your 20 gauge. The green color वाला is your 18 gauge. हमने ये सब डिस्कस किया हुआ था. I'm sure students have benefited out of it. Then we had a question on fibrous, the type of joint. The question was, what is the type of joint between your radius and ulnar shaft? So basically your interosseous membrane जो आती है, ठीक है, हमने देखा था वो आपके syndesmosis fibrous joint आता है. Auditory pathway, we have seen that as well, recently discussed. You have auditory pathway. Vitamin B12, last NEET PG exam, this AIMS exam, you get so many questions on vitamin B12. So vitamin B12 में there was one question which was image based question, knuckle hyperpigmentation. If you have attended your internship, the clinical postings well, you have seen these patients. I remember knuckle hyperpigmentation is indicative of vitamin B12 deficiency. Very, very important clinical sign. Then there was a question, your image based peripheral smear, hypersegmented neutrophils. We have been reading this from your second year of MBBS. I do remember it myself as well till now. Hypersegmented neutrophils, vitamin B12 deficiency. Enzymes affected, there is methylmalonic acid, urea, वो सब होता है. We have discussed this in our sessions. So B12, remember for your NEET PG exam as well. B12 and folate are very, very important questions. You get many questions on these. Next, the murmurs ka maneuver. If you remember, we had a free special class on murmurs where we again discussed the cheat code like your HOCM ka murmur and mitral valve prolapse ka murmur. What is the cheat code that we had seen? All murmurs decrease with this maneuvers except your HOCM and mitral valve prolapse. What was the mnemonic? Right, the mnemonic was vast. You have Valsalva, amyl nitrate and standing. Valsalva, amyl nitrate and standing. तो standing पे question था, तो HOCM और MVP का murmur बढ़ता है. HOCM के मर्मर का इंटेंसिटी बढ़ता है, इसमें आपका ड्यूरेशन पे इफेक्ट होता है, mitral valve prolapse पे. So please remember, again it would have helped you in solving the question, right? So these are just few from the lessons that I had taken. There are many more questions that were asked. So let me take ahead this session regarding the repeats. Now there were quite a few repeats. There were at least 2 direct repeats from your May aims. So one question on deep inspiration में liver का कौन सा part cover नहीं होता है, right? It was asked in your aims June as well. Other question on your titanizing frequency. Again a direct repeat question. So this tells us that seeing your previous year papers is an absolute must. Not only questions but the topics as well. So even for your upcoming exams, FMG ho, NEET PG ho, please focus on the previous year papers. You have to master those topics for sure. So what scores are we expecting in this exam? Now, as I said, since this exam was not very difficult, the scores are going to go high. This is what at least I am expecting. The cutoff scores are going to be high. Let's say maybe 130 to 140. So minimum pakad ke chalo is the score that you have to be in your top 100 अगर आपको आना है तो. So 130 to 140 is what I'm expecting considering the difficulty level of the exam. As I said, if you think you have not fared well, you have another chance waiting. Do not waste your time thinking about कि मेरा INICET अच्छा नहीं हुआ. If you do that, you would just be wasting your precious time and energy. Concentrate on the upcoming NEET PG exam. Whatever is done, it's the past. The future is in your hands, okay? So put in your best efforts for the upcoming exam. We can see that the exams are not very difficult as they are hyped. You just need to know your concepts right. You need to know the cheat codes to solve the questions fast. That's it. Now, a list of the few favorite topics which are there. Expect these questions in your NEET PG and FMG exam as well for the upcoming exam. So there were quite a few questions, not only one, there were many questions on your sexually transmitted infections. Again, we have discussed this in a plus course with mnemonics, the color kits, the various syndromes. Please watch that session, all the Unacademy subscribers, for your upcoming exam, very, very important. Vitamin B12, as we said, favorite with all examiners. There is a question, at least one image-based question on life cycle every time in every exam. कभी निपा वायरस पूछेंगे, कभी हंटा वायरस पूछेंगे. मतलब any question is asked, parasitology, virus, कुछ भी आ सकता है. So there was a question on life cycle, indirect question we had discussed recently, Diphyllobothrum latum का intermediate host. Recently we had discussed that and I mentioned that this question is asked time and again. So please remember Diphyllobothrum latum. It has 2 intermediate hosts. The first intermediate host and the second intermediate host. First one is your cyclops. Second one is your freshwater fish. Which is the other parasite that we saw recently? In the life cycle, you will have cyclops, you will have fish, but along with fish, maybe you will have frog as well. And man will be the dead end in that parasite. Yes, which parasite is that? Your next question for the next AIMS exam. So guys, I'll take up your queries once I share my views. Please post in your queries again. I might be missing in the comments. Once it's done, I'll give you time to post in your queries. Okay, whatever queries you have. 9. Very good, Priya. Absolutely right. Sparginosis करने वाला आपका spirometra. It is spirometra which causes sparginosis. For those who don't know about this, it's a reality check. Please read in detail. We have discussed this recently. Okay. Next one, cannula color. Every exam you see there is a question on cannula color, vacutainer color code, biomedical waste color, STD color kit, Foley's color. Whatever color coding is there, please master it from all the subjects. Questions on COVID-19, of course, are expected in every exam. There were questions in FMGE, history of anosmia. AIMS had 4 to 5 questions. Question 2 questions on drugs, definition of severe case. You had a question on pattern of injury in COVID. So COVID absolutely is very, very important for all the upcoming exams. E-fast or fast, favorite topic with the examiners these days. Every recent AIMS exam, you'll find a question on fast. So expect this in your upcoming exams as well, right? The question was E-fast में abdomen के अलावा और क्या होता है? बहुत easy है. We have discussed this time and again in our radiology classes. Extended, it is for thoracic, that is your pleural cavity, pneumothorax देखने के लिए. You get your barcode sign, stratosphere sign, lung point sign, absent lung sliding. We have discussed all of this. Cadaveric images for your upcoming exams, very, very important. Please do that before your upcoming exams. It's absolutely important you get questions on cadaveric images. They have become a favorite with the examiners now. These are just few topics that I have enlisted here. Like these are must know. You get a question on this for sure. Alright. So now for those who are aiming for the upcoming exams, whatever exam it is, so what are the lessons learned? Before I go ahead to the lessons learned, please make sure that you watch the free live classes, the upcoming ones, the ones that are recorded. Particularly the FMG students, you have your 4 sessions. I have taken FMG final punch as a 4 parts hai. Please watch it before your exam. If I am not able to take classes for this session, please make sure you watch those. They will definitely help you in your exam. Trust me on that. Then the rest of the students, please watch the other live classes. Kaun Banega MD series, brainstem syndromes. These are just few that I have enumerated. Alright. So what are the lessons learned? The lessons learned are topics are repeated. Focus on the frequently asked topics, the previously asked topics, and please do not focus only on the questions. ठीक है, ऐसे पहले के पेपर्स ऐसे सॉल्व मत करना नीट पीजी के एम्स के. हाँ ठीक है, in 10 minutes I have solved 50 questions. You have to be sure that if you are solving 10 questions of previous papers, you have to master those topics. ठीक है. For example, in FMG there's a question on anosmia है, taste गया है, COVID-19. So that tells you that COVID-19 is a favorite topic with the examiner now. You see a question on fast in AIMS May 2020. You will get a question in November 2020. So anticipate the questions that are going to be asked. How do you do that? Is looking at the previous year papers. I would rather suggest कि as and when you are solving papers, jot down the topics in each subject. That will give you a very clear insight into क्या topics important है. So make a notebook. Like you write down all the subjects, your 19 subjects, and as and when you are solving the previous papers, लिखते जाओ. For example, if I'm solving your NEET 2019, when I'm solving anatomy questions, I'll just write down the topic, not the entire question. Let me say there's a cadaveric image, median nerve has been asked. So when I solve that question or when I see this list, I'll ask myself, do I know how to identify median nerve plus radial nerve, ulnar nerve, everything? Okay, not only the median nerve. Physiology mein, now suppose there was a question on GFR. ठीक है, एम्स में. So I will write down topics like this. So when the list is in front of me, I have very clear idea कि these are the topics which are important and these are the topics that you focus in your last 7 days or 10 days. So please start making that list. If you have not done that, it really helps, in the last minute revision. Then the next thing is, the next lesson learned is revision is the only key. Now, what do I mean by revision? Revision मतलब इसका मतलब ये नहीं है कि you will not watch new sessions which are coming up, on Unacademy which we are taking. You have to watch sessions which are on the must-know topics. If any time you feel कि ये topic is not very important, you can leave that. Okay, you have the liberty to do that. But whatever you are reading, please revise. Revision is the only key to succeed in these exams. I know revising is boring. But at the same time, whatever is boring, whatever is not comfortable is something which really bears the fruits. So please keep revising. As I always say, if you are reading for 6 hours in a day, whatever you are reading today, keep 1 hour every day to revise that. So let's say I'm reading for 6 hours on Monday. I'll keep Tuesday 1 hour to revise whatever I have read on Monday. On Wednesday again, I'll keep 1 hour of my portion to revise whatever I have read on Tuesday. Rather than rushing behind the new topics, just going behind the quantity, go behind the quality. Whether you are retaining whatever you are reading, retaining, recalling and then in the exam hall to be able to remember it is very, very important. So please focus on revision. I'll come up with a revision plan for your NEET PG exam. I'm working on it and I'll share it very soon on the Telegram group. So stay connected. I'll update you about that very soon. Next one, images form an integral part of the preparation. Now, pathology, microbiology, anatomy, your radiology, dermatology, subjects where whatever you are reading, you should just Google out the images. As I always say, Google images is something, which will help you. Now, when you are reading bronchiectasis, if Google kar lena bronchiectasis, go to images, bronchiectasis CT scan or some images dekh lena. That will give you a clear idea about what different patterns can appear in bronchiectasis. If you want, please make a folder in your phone, have a folder handy in your phone for all the images, okay? You can also systematically arrange the folders in your phone based on the subjects. ठीक है, मेरे ये रेडियो के images का folder है, dermat के images का folder है, anatomy cadaveric images का है. So when you are saving those images also, if you want, you can annotate also those images and keep. So make smart use of your smartphones that you have, okay? Next one, only notes without MCQ practice does not help. Trust me, don't run behind getting notes from this coaching institute, the other coaching institute and everything. Notes of any institute, of any faculty for a subject are almost the same. सिर्फ 19-20 का फर्क होगा, बहुत फर्क नहीं होता है. What really matters is MCQ practice. So rather than running behind notes of different institutes, I would suggest give test of various institutes. What happens is, if you are giving the test of the same, faculty institute which you have attended the lectures, there is a bias in the setting of the questions. Okay? So it's better to practice MCQ from some other platform. At Unacademy, we are conducting free live quizzes 8 p.m., 9 p.m. It's free for everyone. Just 10-20 questions. Hardly takes your 5 minutes. It's a good break. So you can follow those as well for your quick revisions. Alright. So please do the MCQ practice. You will only master, take it from me, you will get a good rank only if you do MCQ practice. If not, it's very difficult to do that. Next one, the most important lesson, cheat codes are a savior, of course, along with your concepts. Cheat codes, like, in the lengthy questions that you had, many students came back and said the cheat codes that we shared, ruling out the options, reading the question from the last line, contradictory options mein se answer choose karo. There are many cheat codes, which actually help you to score more over others. So please make sure you watch all the sessions, attend all the sessions at least that I am taking or I have taken. You would get to learn a huge list of cheat codes, which will definitely give you an extra edge. Okay? And of course, the last lesson, good vision, particularly near vision, is a must in your CBT exams. Like, God forbid you get those chotu images which you got in AIMS. I hope you don't get it in NEET PG or FMG exam. But just on a funny this thing that you actually need to have a good vision. You need to focus more when you are looking at those images which you have. Okay? So these are the lessons that we have learned. What to look forward to at Unacademy now. Most important, guys, if you are losing confidence, if you feel that you have not prepared well, if you are not getting the right momentum, it's best that you attend online live classes, because that is what is the need of the hour these days. So 21st November, that is today, we have started with intensive revision batch for NEET PG on Unacademy. You can go to the app and check out the entire schedule. So it is a 1-month course. Your intensive revision will happen along with the educators live. You can ask the educators doubts during the live classes. This will keep you on track. Okay, so you can make your revision timetable according to the sessions which are there on Unacademy as well, so that it is in sync with whatever you are revising. Of course, it's not necessary to attend all the sessions. You can watch the initial 10 minutes or so. If you feel that the session is adding value to your preparation, go ahead. If not, you can also watch recorded sessions at 2x speed once the session is not live. So you can actually, customize according to your needs on the Unacademy app. If you go to the popular courses tab in the app, there are these multiple courses that I've taken. Last year I've taken, revision courses for NEET PG 2020. valid even today. Please watch each and every session. Multiple cheat codes, acid-base disorders, ECGs, embryology, immunology. I mean, the list goes on. I've shared the list on my Telegram group. I've taken many courses on your radiology as well. I hope all of you know that I'm a radiologist basically, but with passion I create all these cheat codes and mnemonics. So make sure you attend, to watch those radiology sessions as well. You'll find it under my profile. Okay? As I said, there are these live quizzes happening every day at 8 p.m. NEET PG T20 and at 9 p.m. Along with that, we faculties also take. You can stay connected on Telegram group. These are free live tests on Unacademy, 10 questions, 20 questions. And this is like a good break and assessment for your preparation. Just download the app and you can, attend these sessions. For all the students who are, planning to take up the Plus subscription, which gives you live classes, live polls, a feature which I absolutely love about the platform, and unlimited access to all the courses. Along with that, you have Iconic subscription. What is Iconic? The combination of Unacademy and Prep Ladder. So you can even have rapid revision of Prep Ladder along with Unacademy. So when you are subscribing, you can go to the Iconic thing. You can use the referral code for additional discount while subscribing. Okay? So this is how you can attend the quizzes on the platform, which are free or even live classes. You just need to download the Unacademy Learning app. Select the goal as NEET PG and you can go to special classes, plus classes, whatever you are planning to see. Okay, and these are the various subscriptions that you have depending on whatever course you want. So that was about my, the reviews which I've got from the exam, the lessons that we get to learn. The key point is previous year papers, topics, revision is the only key. Okay, please focus on those. If you do even that much in and out, you master those topics, definitely, you would get a good rank. And stay connected with us for the upcoming sessions. Now, I'll take up your queries now. Whatever queries you have, whatever queries you had typed, please post in again so that I can take up your queries. Strategy for NEET PG further, Preeti, as I mentioned, strategy कोई बहुत ज़्यादा है नहीं. आपको सिर्फ previous year papers के topics master करने हैं. You have to revise, MCQ practice करते रहो. See that your graph in the grand test is going up with every test. Okay? Focus on your weaker subjects. You cannot leave even one subject. ये सोच के कि I don't like radiology, I don't like dermat. You cannot leave even one subject. Work on it. If there is any subject which you feel you have not done well, I would suggest that in, let's say, 6 hours you are studying, 1 hour you have kept for revision. Keep at least 1 hour daily for the subject which you have not finished yet. That is how you go about finishing your unfinished subjects. Okay. Devanshi, COVID-19 session we had already taken on Unacademy NEET PG YouTube channel. Multiple subject experts had taken it. So you can go through that. That shall help you. How to review grand test? Dr. KSND is asking subject wise or wrong to review, what to do first, unable to review properly. So my take on that, grand test review jab aapko karna hai, first of all, decide for yourself when are you going to give the grand test. Is it 1 per week or is it 1 per 15 days? There is no, fix this thing कि आपको 1 per week देना ही है. If the time is too short, if you are an intern, busy with your duties, if you are working, you can give a grand test 1 per 15 days as well. Just giving grand test without reviewing, without improving, you are wasting those 3.5 hours in the grand test. So please do not go only behind the number. Look at the output that you are getting from every GT. Now, how to review is, first of all, give yourself target. Otherwise, the grand test review will go on and on and on. Let's say you want to finish the grand test review in 2 days or maximum 3 days. Okay? 2 to 3 days mein you have to finish. So when you start the review, of course, start with the wrong questions first. Okay, start with the wrong questions first. What I prefer or what I did while my preparation, and it helped, as I always say, for my every subject, I had a separate notebook. ठीक है, मेरे anatomy के notes एक notebook में, physio के notes एक notebook में. We do not jumble up the notes. So you have your separate notebook for each subject. whatever questions you have done wrong, whatever subject they are belonging to, add on the points to that notebook. Start with the questions that you have done wrong. Okay? And then go to the rest of the questions. The next one, the questions which you guessed, which you did not know but you made right. And then in the last, go to the questions that you made right. Reading the explanation of the questions is very, very important, because these explanations also are potential questions. For example, you solve a question on culture medium, right? What is the culture medium for Neisseria gonorrhoeae? Thayer-Martin medium. In explanation, you will have the entire table of all the culture media. So make sure you revise that entire table. So explanation reading is very, very important. As I say, please time box your day. You know, like in this time, I have to finish this. In this time box, I have to finish this much. Until and unless you are a bit harsh with yourself, it's difficult to achieve your targets. So be very, very clear in your what you want to do in the entire day. Plan out your next upcoming 2 months कि मुझे कितने GTs देने हैं, मुझे कैसे कैसे explanation करना है, what I have to do. Your entire timetable should be ready. Okay. Telegram group Alajangi is your Dr. Nikita's Rad Synapse. ठीक है? So you can stay connected with me there as well, and there's a channel also, Dr. Nikita Nanwani, and also on the Unacademy NEET PG Telegram group. We are there as well. We can stay connected on the Telegram group of Unacademy as well. Simran, yes, I am working on the revision plan. Just that you have finished your INICET yesterday. You all deserve a break, you know. If you do not take breaks, you will break down. So take breaks. It's absolutely okay to take breaks. Do not be very, very harsh with yourself. It's absolutely okay. So I am working on the revision plan for NEET PG. I'll share it with you very soon, that how are we planning the daily targets, the daily test, you know, how can we achieve the maximum. I'll share with you soon. Soumya is asking about FMG. After seeing this paper, can we expect questions from this paper? And if we have to do previous year papers, how many year papers would help? And doing NEET PG previous year papers. So Soumya, first of all, I would say that be very, very realistic. You know, do not be very, very over ambitious. If you think that you have the time, you have the potential, you can do it, then you can go for previous NEET PG papers. But this comes only if you have first mastered the recent FMG papers. Please do not run behind your NEET PG and AIMS papers without doing the FMG papers. So mastering the FMG papers, as I said, the topics, not the questions. First, target that. I would say that should be enough initially for your exams. So your at least 3 years papers, since you have 2 papers in a year, topics should be enough for your preparation. Alright. Nishu, how many year papers? I would say 3 year papers are a must do. But this is like the bare minimum. This is like the bare minimum that you have to do. If I was in your place, I'll tell you, when I was appearing for my exam, it was All India PG, not NEET PG Tabi. It was in the year 2012. You won't believe I had solved all the papers, like not only 2007 to 2012. I had solved all the papers right from 1994 till the year 2011. Because when you do that, you know, this is how you get the multiple sources of questions, the reliable MCQs that you can get. So I had solved all the questions up tak ke jitne bhi exams hue the, and these papers which were there, rather like 1994 to 2005, they had really some good questions. ठीक है, ऐसा नहीं है कि वो क्वेश्चंस बहुत बकवास थे, पहले के क्वेश्चंस बकवास हैं, ऐसा नहीं है. If you see the analysis of NEET PG 2019 as well, there was a good chunk of questions which came from this year papers. So I'm not telling you कि पहले ये papers करो. Go retrograde, okay? Go retrograde. 2020 का paper करना है, 2019 करना है, 2018, 17, 16, 15. So 3 years, as I said, are must do. 5 years is, I would say, again a must do. Matlab for me, 5 years is like, I would definitely recommend that. If you have time, you should take out time for doing the last 10-year papers. Okay? The more questions you attempt, the more speed you get. You get an idea into how all questions can be framed. So rather than focusing more on notes now, please focus on the MCQs. Take a retrospective pattern of preparation. Solve the questions, previous year papers, and then get back to your notes for those respective topics. Rather than आप बोलोगे कि मैं पूरे anatomy के notes पढ़ता हूँ और फिर मैं question solve करूँगा. No. Please solve the questions. Wherever you are stuck, you feel that this topic I'm not feeling confident. If there is any other question which will be asked on this topic, I will fumble. That's the best time to go back to your notes. So questions is something that you have to focus now. Okay? So John, is there any possibility that NEET PG will be on 10th Jan? There is any possibility. Now that they have said that, it is deferred, so we expect that it would be delayed. But as I said, worrying about something which is not in your hands makes absolutely no sense. Okay? Let us prepare considering that the exam is going to be on 10th Jan. Even if it is postponed, that is the extra bonus time that we get to revise more. So please prepare like your exam is on 10th Jan itself. Okay? So that it keeps you on toes. And stop worrying about कि exam कब होने वाला है, pattern कैसे होने वाला है, will it be a new pattern, will it be next pattern, whatever it is going to be, whether prepone, postpone, new pattern, it is going to be for everyone. What is only in your hands is the time that you have now. Make the best use of it. As I always say, you should not have any regrets. Ki I wasted my time, I could have utilized this time rather than wasting thinking about things which are not in my control. So whatever time you have, make the best use of it. Flawless, it's me. What would I advise about Unacademy subscription? All your videos will be available to watch. So yes, even if you take Unacademy subscription now, whatever sessions I've taken up till now, it's like 1 year is when we started, you will get all the sessions. And this is not to boast or to misguide you. I mean, I will never do that at any cost. This is to tell you that these sessions will definitely help you in, getting the ideas of how to solve the questions, how to remember the stuff. So I would say yes, Unacademy subscription will definitely help you, and you can watch all the sessions that I have taken up till now. You can go sequentially, starting from the beginning. Watch it at 2x speed so that you don't waste too much time on it. When you watch the recorded sessions, you have the advantage. The PDF is available alongside besides that session. So what you should do is download the PDF beforehand, before you are watching the session. And as you are watching the session, साथ-साथ में वो PDF में mark करते जाओ, notes बनाते जाओ. So this way you will save your time and you are, making notes as well. You will get annotated PDF, that is the educator has written the notes without annotations also. So you can download both. So keep at least 1 hour every day to watch those sessions. Trust me, they will definitely help you in scoring more in your exams. Be it your FMG exam, be it your NEET PG exam. The topics are such which are important for all the exams. Okay? And yes, you can remember the referral code Dr. Nikita while subscribing for your additional benefit while subscribing. Or you can use any other code which you have. Any code, it's not necessary to use this code only. No, Naveen, revising now, I would say by GTs. Okay, if you have not done the subject-wise test before, it's high time that you should have done by now. But agar nahi kiya hai, you can refer to subject-wise test only for your subjects which are your weaker subjects. Okay? Not for the subjects which you feel you are good at. So subject-wise test only for the weaker subjects so that you make those subjects strong. Otherwise, GTs are your way ahead. Okay, GTs are your way ahead. Source for previous year papers, Pooja, whatever resources I have shared it today only on the group. Jitne bhi papers the. So as and when we get more sources, you get more sources. Keep sharing on the Telegram group. You have previous year papers on the various platforms available. There are e-books available. So you can get from multiple sources, right? As I said, I've shared quite a few papers today itself. Anything else? No geeky monum. Unacademy is not considering, at least as of I don't know, any special prize or anything being offered. Cadaveric images, Ajal is asking how to make it easy. When you see cadaveric images, take your anatomy book alongside you, which is your BDC है या आपका कोई भी atlas है, उसके साथ correlate करके देखो. Cadaveric images, I know they are very hyped topic, but actually it's very very easy. If you know your anatomy well, you can crack them. आपके atlas के साथ रखो, just identify the bones, ठीक है, ये muscle कहाँ जा रहा है, कौन से direction में जा रहा है. It's actually very easy to identify those. Any other queries before we wind up this session? Okay, cadaveric versus radio ka collaboration class. Let us plan on that, even on cadaveric images, whatever sessions we can have. You can keep suggesting me whatever topics you are afraid of. I'll try my best to take those topics and make it easy for all of you. Okay. No, Aditya, weaker subjects, if you keep them till the end, they will always remain the weak subjects. So, if you have watched a video on my YouTube channel, eat that frog. That frog is the most ugly thing, the most difficult thing. Once you have eaten that frog, you feel like you have done the majority of the work. So, work on your weaker subjects right now. Don't keep it till the end, otherwise you will really panic at the end. Okay, don't do that. For the review of your INICET 2020 exam, that means your subject-wise question discussion, we at Unacademy have already started sessions on the Unacademy app as free special classes. So make sure you watch those sessions. The respective subject experts are taking your recall sessions on those. You will be having YouTube sessions also in the upcoming days. So these would be available to everyone. Your detailed recall-based questions would be there. Okay? So I think, yes, we can conclude here. It's very, very easy to prepare for the exam. Just that don't worry much. Have faith, have confidence, keep playing the game till the last moment, okay? And you all will rock. I know you all are amazing, working hard. And if you're working hard, of course, luck will favor you. So that's all for today, guys. For any other further queries, please feel free to reach out to us. We shall be happy to help anytime. As I said, stay connected on the Telegram group and we'll be there to help you all till the last moment, okay? So goodbye, take care, keep studying, keep revising and keep winning. Thank you.